Hi, everybody. My name is Marketa Huskava, and I'm the Executive Director of American Nurses Association California. And I'm joined today by Roxanne Gould, ANAC contracted lobbyist.
Hi.
And so we're here today to give you a legislative summary of the 2021 legislative session. And we now know what Governor Newsom signed or vetoed. And so we have what bills he signed or vetoed. And so we have a list of bills that he signed. And so we've been covering these bills throughout January in our legislative updates. So we're just going to go through the list and we tell you what new exciting laws are there. And then there are a couple, 2 or 3 two-year bills. So we're going to tell you about them. So first bill, what Governor Newsom signed was AB 107, and that's Rudy Salas. And so it says that military personnel, that they can apply to DCA, Department of Consumer Affairs here in California, and that they can get temporary license, right, with specific documentation, but they can be issued temporary license. So, there is a way how we can remove barriers, right, especially for nurses, remove barriers to actually join the workforce here in California. The next one, I guess, if we go just definitely by the list. The next one is AB 285. And Roxanne, is that the 2-year bill?
It's a 2-year bill, and that's the one that we supported, and that would have required that in the Department of Education, you have to have a school nurse. And so, in the era of COVID, with all of the schools that are little by little losing their school nurses, in the very least, having one in the Department of Education would help in at least advising and helping schools address the need for healthcare on campuses.
So so that's AB 285. So it's a 2-year bill. Next bill is also a 2-year bill, right? It's AB 410.
That was the compact bill.
That's the e-compact, right? So that's also a 2-year bill. So Roxanne, what is the deadline where the authors, they have until?
They have, we're in a 2-year session, as we've talked about before, and a bill introduced in the assembly has to make it out of the assembly by the 2nd year at the end of January. So this bill, since it is an assembly bill, it has until they reconvene January 3rd, has until the end of January of 2022 to determine its fate, whether it's going to survive or not.
Okay, so all these 2-year bills, we have, I think, 1 or 2 on our list. So all these 2-year bills, they have to be out of the House of Origin by end of January. If they're unable to make it, the bill dies and it just doesn't move, correct?
Correct, yes.
Okay, all right.
Yes.
So next bill, which actually Governor Newsom signed into a law, is AB 527 from Assemblyman Jim Wood. And that is really reflective of Schedule 3 controlled substances. And so the law states that specific compounds and specific combinations, specific class 3 controlled substances can be exempted from class 3 or from controlled substances if there are non-narcotics additives. And so that is something for nurse practitioners and nurse midwives and certified registered nurse anesthetists. So that's AB 527. Then we have another 2-year bill, right? AB 562.
Yes, and that dealt with mental health care for
frontline providers.
Exactly, exactly. And we're very disappointed that it didn't just sail through. I mean, the frontline providers are taking the brunt of dealing with COVID and this healthcare crisis we're in. But it didn't sail through, and for some reason, I mean, it's still alive, but much like the other bills, the 2-year bills, it has until the end of January 2022 to potentially pass or fail.
Yeah, and especially, since ANAC, we were hosting at the end of September 2021, we were hosting a fantastic mental health panel, and we were talking about the barriers, how important it is for nurses to have access to resources, how important it is for employers, what important role employers play in this, what important role the state plays in this, so we can assure that nurses and healthcare and other healthcare providers, that they have access to mental health resources, because we know where we are, the burnout, the depression, the exhaustion, the exodus from our profession. And so this was very disappointing, and we covered it last time when we talked about this. So again, this bill has until end of January 2022 to hopefully make it through. Then we have a good one, AB 570, and that's from Assemblyman Santiago. And so Governor Newsom signed into a law that what Obamacare or the ACA from 2010 that allowed, right, that children can stay on parents' health insurance until they are 26. This is in addition to that, and it states that in California now parents and step-parents can be on their children, grown-up children, that they can be on their health insurance
if they're dependents.
If they're dependents, yeah. So there is this option. So that's AB 570. Next one is AB 852, another 2-year bill, right? And that's Assemblyman Jim Wood, and that is the cleanup bill to AB 890, the nurse practitioner bill that we've been still waiting for BRN to promulgate regulation and figure out what we're going to be doing with that. So so since there were a couple of issues were unclear, so Assemblyman Jim Wood is authoring AB 852, to do a cleanup. And again, 2-year bill, so he has until end of January 2022 to figure out what to do and move it. Next bill that was actually signed was AB 1015, and that's Blanca Rubio. And that's bill that we've covered before, and that states that the BRN must use relevant regional data for their decision-making processes. So in terms of what the needs are in specific regions in California, what, how enrollment in nursing schools, how it should look like, clinical placement. So all of that now, AB 1015 now mandates that BRN uses regional data to make those decisions. So we are attending all those meetings, so we will be updating you how is that being put in practice starting in January next year. AB 1407, we talked about it in our previous legislative update, and that's Assemblywoman Ottenberg, and that's the implicit bias training for nursing for all nursing courses, and it's the continuing education courses. And so it states that that from January 1st, 2022, continuing education providers must offer 1-hour course on implicit bias. The question is, is 1-hour course on implicit bias, is it really moving the needle? Is it really the best way how we can talk about microaggressions and racism? And right,
it's definitely taking a step in the right direction. Because if someone is naturally going to be biased, I don't know how many hours would make a difference there, but for someone who isn't aware of that kind of behavior, that this could help educate them and at least bring light to that.
Good point. Next bill that Governor Newsom signed into law, it's AB 1532, and that's the famed BRN sunset bill. However, there is a caveat to it. BRN did not get 4 or 5 years. BRN got 1 year. So they have not been sunsetted. They've been given 1 year until January 1st, 2023. And so there's going to be another sunset because the legislature wants to know that specific processes were improved, that that certain guidelines are being followed, and that the analysis, they might be another state audit analysis, and so making sure that that all the decision making is being done appropriately. So that
some legislators felt as if they were giving the BRN guidance and direction and telling what they wanted to have done and accomplished and the way they wanted things to be handled. And some legislators felt as if the BRN was basically saying, okay, sure, and then ignoring those kinds of guidances. So that's why 1 year is pretty unusual for a sunset, because there's a great deal of work and preparation goes into those hearings by the BRN or whatever government entity. So it's a sign that the legislature is serious.
And that we reported back to you that we've attended the 2 joint sunset legislative hearings. Roxanne testified at both, and so those were really all day hearings. And first one was in March 2021, the second one was I think in May 2021, and those were really deep discussions, and there was lots of questions, a lot of analysis. And so it's good that the legislature is taking it seriously, because the future of our profession in jeopardy. And so especially, you know, in the situation where we are right now, I don't know if you know, but I think that Jared at our office, he shared it with you, that there was the recent latest study from UCSF, from Dr. Joan Spetz. Now, after post-COVID-19, the projection is by 2025, we're going to be short of 40,000 nurses. So that is a pretty deep hole. And if we really do not look into improving and innovating and moving nursing education into, you know, 21st century, and if we don't look into how we can really use the different learning techniques, because we are in 2021, it's really important that the BRN has 1 year to update and upgrade their ways of doing business. And we have been attending the meetings. We are asking questions. We are working in concert with all our coalition partners. And so this is something that is really important. So we are glad about that. Next one, SB 65. So SB 65, we get to Senate bills. SB 65 was omnibus, and it was about mom and maternal care services. So it was called Momnibus. And so it was signed into a law, and it says that, what does it say? We just read it. We just read it. We just read it. It not only gives money, and especially money from California budget, to specific child and maternal healthcare services, but it also says
underserved.
Yes.
Yes. Underserved and economically disadvantaged.
Yes, 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 yes. So now we have in California, and in California budget, now we have specific money to assure that underserved, especially rural and some urban areas, that actually child and maternal services are being provided. Mm-hmm. So that's really, really important. Next one, what Governor Newsom signed into a law, and I know Jared already sent you an update, was SB 380. And that is the End of Life Care Act. And we were a big supporters in 2015, 2016, when this bill was first discussed, and it was passed, and it was passed as a pilot project. And so now in 2020, 2021, it was important that the legislature, that they hear, how the pilot project went. They received data. It was actually the number of people the number of terminally ill patients with less than 6 months of life expectancy, and with very specific guidelines, what they have to follow. The number was actually very low. Initially in 2015, 2016, the opposing parties or opposing organizations were claiming that people in California will be, abusing the law, right. and that people will have access to these life-ending medication, which really, proved to be absolute error. And so the numbers of patients who actually took the opportunity to take opportunity of this option was actually very low. So we have that. And then SB 374, that's Assembly Woman Men. Mm-hmm. And so Governor Newsom signed into a law that acts of reproductive coercion are now criminal activity, right? So if somebody would be coercing, harassing, coercing, saying what you can and cannot do. So, anything in terms of reproductive freedom, reproductive health, access to care, that is all considered reproductive coercion. And so that is against the law. That's now illegal. Mm-hmm. And last but not least, we have SB Senate Bill 428, and that's Hurtado. Mm-hmm. And so that says that insurance plans and all pediatric departments must provide guidelines to screen for pediatric adverse childhood experience. Yes. Screening, right? And we know because Dr. Nadine Burke-Harris, who is the California Surgeon General, she's a pediatrician, and her whole career, or bulk of her career, was spent on childhood adverse experiences. We all know, we've all read the studies, we all know how toxic and how detrimental and how debilitating those early early experiences are. And so now Governor Newsom signed it into a law that starting January 1st, 2022, all pediatric departments must screen for these.
There were
What
about
else?
over 2,400 bills were introduced in 2021. Of those, approximately 860 made it to the governor.
Okay.
And of the 860, he signed about 770.
Yeah.
And
Really high percentage.
yes.
Yeah.
But it doesn't mean a number of those bills that were introduced this year could still come back. And then the legislature also then has the opportunity to introduce brand new bills in January, as of January 3rd. So we will stay on top of every bill as it's introduced and every bill as it's amended, and continue to give you updates on legislation of impact and to the field of nursing.
So can you say it one more time? So then when they come back, right, January 3rd, so what is, how many weeks or what is the deadline where the members of California State Legislature can be introducing new bills for 2022 session?
They can introduce bills into the spring of 2022, and everything has to be done by the end of session in 2022, because by 2023 we start a brand new session and start all over again.
And plus 2022 is another election year, right? So it has to be all done and passed and vetoed and signed by, again, August.
The end of August has to be passed, and the governor will have 30 days after that to act.
Because then, then everybody's going to be back in their districts and campaigning again. Yes. So we're so looking forward to that. I think that's it. Any last thoughts on 2021 legislative session?
Only not thoughts, but suggestions. We say this in almost all of our videos, but reach out to your elected officials. Let them know you're in the field of nursing. Let them know you're a resource. There isn't a single nurse in the state capitol, in the legislature. And if they don't have us or you to rely on to say, what do you think? How does this impact nursing? Who are they going to rely on? And do you really want them going to another resource to, determine how to vote on legislation impacting nursing? And they will value you like gold. Constituents are exceptionally important to legislators. So please consider reaching out and making yourself available for that purpose.
Great. So I would like to thank all of you for keeping up with us and for watching and listening and learning from us. Thank you, Roxanne, for your time, for your ongoing advocacy on behalf of ANAC. And also I would like to thank Jared and Teresa at our office, because thanks to them, they create all those updates and they edit our videos, our lovely videos, and they draft all the social media updates and website updates. And so we brief them and then they draft the updates for you. So I would like to thank them for all their hard work. We wish you wonderful fall. And actually, I cannot believe it. We are still like in October, but all right, it's here. So happy Thanksgiving and then Merry Christmas soon, because we are moving into the second part of fall. And so I guess, we will all see you in, I don't know, middle of January, but whenever we have some bills that will be introduced, we will continue to do our reporting and keeping you updated and keeping you educated. And I think that's it, right?
Yep. Please feel free to reach out to us if there's anything we can do to be of assistance.
Absolutely. So thank you so much, everybody. Take good care of yourselves. Let's survive fall. And we look forward to seeing you in January. Bye. All right.
That's so funny. We just